going to discuss about the topic National Mental Health Policy vis-a-vis National Health Policy. So, what are these policies going to talk about? Okay, so we have got these various mental health programs and other programs which gives us the knowledge or it imparts us about the level of mental health care services which is being delivered to the community. So, this National Mental Health Program will give us the idea about the plans which the government of India has made according to the different 5-year plans, right? So we'll see the concept of the National Mental Health Policy. According to WHO, the mental health policies describes the values, objectives, and strategies of the government to reduce the mental health burden and to improve the mental health. So, what is the whole concept of the National Mental Health Policy? It is to reduce the burden of the mental illness as well as to improve the services of for the mental health. They have got a vision to help establish a blueprint for the prevention and treatment of the mental illness, rehabilitation of people with the mental disorders, and promotion of mental health in the community. So, the overall vision of the National Mental Health Policy prevent and treat the mental disorders and also give the rehabilitative services for people suffering with the mental disorders. And one more thing is to promote the mental health in the community. So this is the concept of the National Mental Health Policy. The first draft of the National Mental Health Policy was prepared in the late 2001 and it came into existence in the year 2003. It will provide the necessary conceptual framework for achieving certain goals. What are those goals that I will be discussing further? And it is also being energetically implemented with adequate budgetary support in the 10th 5-year plan. So the government of India, it has given us the policy with the budget. They have got the budgetary plan for delivering the mental health services. So what are the policy's objectives? The first one is the district mental health program is redesigned around the nodal institution where most instances will be the zonal medical college, school mental health programs and dementia care services may be gradually integrated into this district mental health program. They have got a goal that the services which are related to the school mental health program as well as dementia care services which will be integrated with this district mental health program. The second objective is the strengthening of the medical college psychiatry department with the view to develop the psychiatric manpower, improve the psychiatric treatment facilities at the secondary level, and to promote the development of general psychiatric hospitals in order to reduce and eventually to eliminate the large extent of the big need of the mental hospitals with their attendant infirmities. So you know that if you take the earlier days, there were very poor mental health services, very few mental hospitals were there to deliver the care for the mentally ill clients. So this policy had got the objective of having the psychiatric department in the medical so that they could produce the psychiatric manpower for treating the mental disorders and also improve the treatment facilities at the secondary level of the care and promote the overall the general psychiatric hospitals in order to reduce the shortage of the mental hospitals, right? So that was the second objective. The third objective of the National Mental Health Policy is streamlining and modernizing of mental hospitals to transform them from the present mainly custodial mode of tertiary care centers to excellence with the dynamic social orientation for providing leadership to research and development in the field of community mental health. So, the third objective of the national mental health policy is to modernize the mental hospitals from the contemporary institution, which was mainly giving the custodial care, to the deinstitutionalization, that is the tertiary care centers, and also for the development of the research in various and also for the development of research in the community area. Then the fourth objective is strengthening of central and state mental health authorities in order that they may effectively fulfill their role of monitoring ongoing mental health programs, determining priorities at the central or state level, and promoting the intersectorial collaboration and linkage with the other national program. So, what is this? The objective is to see to it that the authorities in terms of central level and at the state level are, so that they will be monitoring the various mental health programs, and also at the central and the state level there will be inter-collaboration with the other national health programs. So that is the fourth object. Research and training aimed at building up extensive database relating mental disorders and their cause or outcome, development of better or most cost-effective intervention, modes of prevention of intersectorial research, and providing the necessary inputs and conceptual framework for the health and policy planning. So, what is this objective? The objective was to conduct many researches and epidemiological studies to find out the incidence or the prevalence of the mental disorders in the community. What is the mortality of the mental disorders, and also to see to it that the services what is provided is cost effective, and also the preventive and promotive aspects of mental health also was one of the aspect in this particular objective. So the next objective is focused information, education and communication activities with the active collaboration of professional agencies such as the Indian Institute of Mass Communication, and directed towards enhancing the public awareness and eradicating the stigma or discrimination related to the mental illness, which will form an important component of this policy. What is this is IEC. IEC, information, education and communication. So since the community had a lot of stigma attached with the mental disorders, a lot of misconceptions were there in the community. So people were not accepting the mentally ill clients. So the only way to eradicate that particular attitude or the myths related to the mental illness was to create awareness programs in the community via the information, education and communication. These are the policies objectives. So moving on to what are the goals which are related to the 5-year plan. So we have got different roles according to the 5-year plan. So we'll see what are the prioritized goals for the 10th 5-year plan, which is from the year 2002 to 2007. District mental health program will be extended to one district attached to each of the 100 medical colleges in the country, thereby covering the 100 districts in the first phase, and thereafter expanding 100 district more in the second phase. So thus we can have the 200 district across the country. So what is this is, if 100 medical colleges are attached to one district, so a district will be getting the district mental health program. So in the first phase that they will be covering the 100 district, and in the second phase also likewise they'll be covering the next 100 districts, thereby the whole districts what is there in our country will be covered under this, covered with the district mental health program. The next one is strengthening of the medical colleges with allocation of 50 lakhs rupees each to 100 medical colleges for upgrading departments of the psychiatry. We have the 100 medical colleges, and each medical college will be given we will be given an allocation of 50 lakhs to see to it that the department of psychiatry is present in each and every medical colleges. Right. The strengthening and modernizing of with the aim of reduction in chronicity through intensive therapeutic intervention using non-conventional antipsychotic medications, promoting care of chronically mentally ill in the community using outreach maintenance modalities. So the traditional way of treating a mentally ill client in the custodial setup was to be improvised with the modern technology or the modern or the advancement in the area of care service in the mental hospitals, like making use of conventional antipsychotic drugs to treat the to treat the mental disorders, and also to promote the chronically mentally ill clients in the community area with the outreach programs. So in the 11th 5-year plan, so what are the policies the government has made? So from the year 2007 to 2012, the 11th 5-year plan has got these objectives. The district mental health program will be extended to another 200 districts where consolidating same in the 200 covered at the end of the 10th 5-year plan. So in the 10th 5-year plan, we covered the 200 district hospitals with the district mental health program. So in the 11th 5-year plan also, another 200 district to be covered with the knowledge related to the district mental health program. Quality as well as quantity improvement will be introduced in the area of research, training and IEC, with more focused attention on epidemiological catchment area surveys on a larger scale. So another emphasis what was done in the 11th 5-year plan is the improvement both in the quantity as well as the quality in terms of areas of research, the information, education and technology, as well as training of the health professionals. So the epidemiological studies which has to be conducted in the mental health department. Next is the 12th 5-year plan. So in the 12th 5-year plan, which is from the year 2012 to 2017, so what are the plans? The district mental health program will be extended to the remaining 193 districts, and gains made in the previous plans will be consolidated. Further upgrading the psychiatric department in the medical colleges will be undertaken, and 20 mental health hospitals will be reconstructed. So in this, another 193 districts will be getting the program, and also there will be upgrading the psychiatric departments in the medical colleges. And one more important thing is the 20 mental hospitals were reconstructed. So that was the plan. Next is IEC activities will be augmented to cover all the sections of the population across the whole country. So the information, education and the communication related to the mental disorders or the mental health programs will be covered to the entire country via the National Mental Health Program, which is the 12th 5-year plan. So what are the special issues? So what are the special issues? So the special issues is concerned with the geriatric. So in geriatric, there are many mental disorders which are occurring. It can be the Alzheimer's disease or various types of dementia, or it can be the Parkinson's disorders, depression which is late onset. So all these happens in the elderly individuals or the senior citizens. So that is one of the special issue which happens in the geriatric. The another thing is which happens for the women, dowry related ill treatment and rape and incest. So these are some of the issues which are closely related to the mental health of the individual. The another special issue is victims of poverty or destitution or abandonment. There are women who are put out of their marital life, or there are old people who are just left abandoned, or there are such a group will have to feed themselves, or they are such a group are left out on the streets to fend themselves. So this is another issue which is happening, which requires a lot of mental health services to these special children and adolescents affected by problems of maladjustments in other scholastic performance, depression or psychosis of earlier onset, attention deficit, attention deficit hyperactivity disorder, suicidal behaviors resulting from failure in the examination or the environmental stresses. So if you take the child and adolescent population, so even they are suffering with the childhood disorders. It can be the autism, or it can be the attention deficit hyperactivity disorders, or depression or psychosis, which happens in the earlier stages of development. If you take the adolescent period, there will be problems related to the abuse of drugs and substances and failures in the examination. All such things can predispose of the adolescent to end up with the suicide, and also the environmental stressors which are there for the child and adolescent, so which is having great impact on the child and adolescent group. The next issue is the victims of natural or man-made disasters such as cyclone, war, terrorism, with special attention to the specific needs of the orphan children by such disasters. So if you take the disasters, so we have got natural and man-made disasters. So the children were orphaned during the disaster. So even such children have to be given the mental health services. The National Health Policy was launched in the year 1983, and it was revised by 2002 with the objectives of achieving the acceptable standard of good health among the general population in the country. The approach also was to increase the access to the decentralized public health system by establishing new infrastructure deficit areas and by upgrading the infrastructure in the existing institutions. So in the year 2002, the new objectives were related to the improving the standard of the health in general population, and also the decentralization of the public health system was done in the hospitals where the infrastructure was deficit, and also the new infrastructure in the existing hospital was to be done. What are the special recommendations with regard to the mental health? Right, upgrading infrastructure of institutions at central government expense, so as to ensure the human rights of this vulnerable segment of the society. The human rights has to be secured. So what was done is the infrastructure in the hospital were to be upgraded so that the basic human rights is being secured. Second thing is envisaging a network of centralized mental health services for ameliorating the more common categories of the disorders. So that is the centralization of services to be given for the various mental disorders. Mentally ill clients are also the ones who are going to suffer, who are going to debilitate themselves as well as their families. So those people who are bearing the serious problem has to have an improvement in the quality of the life. Okay, so this program was supporting the individuals who are suffering with the mental disorders, and also the families who are having these problems. Next is mental health institutions are woeful deficient in the physical infrastructure and trained manpower. So, in the year 2002, the National Health Policy addressed itself of these kind of deficiencies in this um, infrastructure and also to upgrade this in the public health sector. So this is about the national mental health policies and what are those objectives or the goals of the national mental health policies, which the government has taken the initiatives to improvise the mental health services to the community and the population in our country. Hope you all have understood the topic.